I'm Connor McCutcheon, and welcome to my TED Talk on sleep problems and solutions. Feeling crabby lately, or simply worn out? Perhaps the solution is better sleep. Did you know 30 through 50% of all adults have insomnia in the course of a year? 1 out of 3 people have insomnia at some point in their lives. 70% of Americans suffer from sleep disorders and wakefulness. 60% of these are a chronic disorder. An example is sleep apnea. What is it? During the apnea, the patient stops breathing and consequently stops snoring. Blood oxygen saturation falls remarkably low, resulting in a sudden drop in oxygen levels. Here's a video clip. As you can see, his oxygen level in his blood is very low and he wakes feeling choked. The oxygen level slowly rises back to normal. Let's talk about insomnia. Symptoms of insomnia. Let's watch this video.
Symptoms of insomnia may include waking up often during the night, having trouble going back to sleep, waking up too early in the morning, and feeling tired after waking up. Apparently, when you don't have insomnia, when you wake up in the morning, you actually feel rested. I didn't know that was supposed to happen.
So why does our brain need sleep? Let's look at the picture. It shows activity in the awake brain, the sleeping brain, and REM. You can see the brain uses different parts at different times, but the sleeping brain is in a turned off mode. You can also get mental disorders such as depression and anxiety and other illnesses. Let's take a look at some illnesses that affect the body. You have lower performance, slowed reaction time, risk of depression, and risk of anxiety. Others include obesity, poor immune system function, high blood pressure, risk of heart disease, and risk of diabetes. Study on the brains of live mice. Did you know that your body tissues, including the brain, have 2 different jobs? One is to work and make new cells. 2 is to get rid of wastes. Do you know how the brain does this? In a study on the brain of live mice, scientists made some interesting discoveries. The picture above shows a brain awake on the left and asleep on the right. The active brain on the left has no cerebral fluid flushing into the area around the blood vessels, so the active brain is working. The one on the right, the asleep brain, shows fluid rushing in green to wash out the wastes. Scientists think that this is compelling research for Alzheimer's patients. They may have had sleep problems for years before getting Alzheimer's. Their brains may have not taken out the garbage at night. So how much sleep do we need? The National Sleep Foundation has recommended these hours for different stages of life. We need less and less as we get older due to the fact that our bodies don't have as high metabolism, which is needed to make new cells. Teenagers, 14 to 17 years old, need 8 to 10 hours of sleep, whereas a newborn infant takes 14 to 17 hours of sleep. An elderly person, age 65 or older, needs 7 to 8 hours of sleep. So what can you do? The Mayo Clinic suggests 7 simple steps. 1. Maintain a sleep routine and go to sleep at the same time each night. 2. Pay attention to what you eat and drink. 3. Create a bedtime ritual. 4. Get comfortable with a pillow or a fan. 5. Get exercise regularly. 6. Limit your daytime naps. And 7. Manage stress. This has been my TED Talk on sleep.